What is a healthy building? We get this question a lot. The short answer is that many factors go into making a building healthy. So here are a couple of examples. Healthy buildings have better air quality. There are a number of different ways to improve the air quality, which include having a mechanical system that pulls in more fresh air into the building, or having better air filtration. Or you might have operable windows that people can open when the weather is nice. And of course, air quality can impact not just the transmission of disease in a building, but there's also a direct link between air quality and how well people can think and work. Healthy buildings control for sound and noise, which can impact concentration and cause stress. This includes noise from the outside, like ambulance sirens, but it also includes noise from inside the building, like the building's mechanical systems, or even the people around you who are talking loudly while you're working towards a deadline. You can address these problems in buildings by using better sound insulation between spaces, but you can also plan for some spaces to be used solely for heads down focus work, like a library type space or individual focus rooms, while at the same time having separate group spaces that foster collaboration, teamwork, and socializing between colleagues. Even furniture can impact health. The average American sits for about 13 hours a day, believe it or not. Sitting too much can impact metabolism, weight gain, or even life expectancy. So by having better furniture and planning a workspace better, you can encourage people to keep active during the day, and you can also help prevent repetitive strain injuries. Thermal comfort, if it's not planned for properly, can be another source of unhappiness. How many of us have had to work in buildings that are over air conditioned and have had to wear a coat in the middle of the summer? You can address this problem with better controls or even different spaces that accommodate people who are naturally too warm or too cold. Lighting can make a huge difference in our health because it impacts our circadian rhythms or internal biological clock. So if you don't have a window at work, or if you have inadequate lighting, you'll likely sleep up to 40 minutes less per night. And this is like being in a state of mild constant jet lag. Access to nature is another component of healthy buildings. Nature is really important because it reduces stress. So in hospital rooms where patients have views of nature, these patients actually recover faster because that reduced stress helps the immune system perform. Food and nutrition. The healthy food options that you offer in your building are important because nutrition is linked to chronic disease. One more example is materials. Healthy buildings should be built with finishes and furniture that don't emit harmful chemicals, which could be absorbed by or accumulate in our bodies and possibly cause long-term damage. So there are a lot of things that go into making a building healthy.